Hello, I am Dr. Mirela Cherneyanu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Welcome again to part 2 of the Wellness Pearls and Words of Wisdom about wellness checks in your 40s. And I'm going to dive right into where I left off. And as I promised, this episode is continuing with what you need to look at from a wellness standpoint in your 40s. So as a recap, I talked about the weight, the height, the waist measurement, the body mass composition, and some cardiovascular wellness indicators like your resting heart rate, your maximum heart rate, your recovery heart rate, and so on. Next, and to dive right in, is blood pressure. This episode is not about blood pressure, but this is a very important indicator for where your cardiovascular health is going, because hypertension or elevated blood pressure is a silent killer. And if you're going to fast forward me at this point, because you're like, I don't have high blood pressure, I don't need to listen to this, you need to know what the markers are and when you need to start worrying, because I've had many men and women walking into my office for a routine visit to simply find out their blood pressure was 200 over 120 or some crazy number like that. And it's a complete surprise. Most of the times, these people know they have high blood pressure, but either they take a medication that doesn't work or they have been prescribed medication and don't take it, as they are in denial and refuse to treat the blood pressure. There are some extreme patients who have anxiety around taking their blood pressure. These are mainly women, not so much men. And these are very similar to the women who have anxiety around their weight being measured. Now remember, this is just information about your body. This is not an exam you have to pass with high marks or you fail. It is just information. Information to you and information to your doctor. And any information about your body is information of how well your body is working. Your blood pressure measurement is a very, very, very valuable information about your vascular system. Its elasticity, its plasticity, its resilience to endure and allow you to live for the next 1, 2, 3, 4, or 5 decades. You need to know this number and there should be no anxiety around it. Now, if you have anxiety about weight or blood pressure and possibly about other issues, you probably need to consider the fact that you have anxiety. And this is another topic for another day. We're going to talk some mental health eventually, so stay tuned and keep listening. I'm going to get there. So bottom line, if your blood pressure starts displaying signs of being elevated, I mean more than 130 systolic and over 80 diastolic, then you're having the beginning of a problem or a serious problem, depending on what the blood pressure actually is. Do not ignore this. If there is something you can do, this is when you need to do it. When your blood pressure is borderline, if you wait until your blood pressure is 150 to 160 systolic or above, or over 90s to 100s diastolic, then you have a much bigger, more serious, more likely permanent problem that will take major lifestyle changes to reverse and some serious medication to control. If your blood pressure is elevated in your 40s, this is a big deal. It is not supposed to happen this early in your life. It's not supposed to happen at all if you're healthy, but the majority of us, unfortunately, will not stay healthy as we get older. Our bodies will withstand a lot of wear and tear. Some of us will tolerate it and age better, and some of us will not. So consider investing in a comprehensive analysis of your health and wellness to understand why your blood pressure is elevated. At this point, the amount of stress you're under, your diet, how much you exercise, the amount of salt you consume, the amount of toxins you're exposed to. I did say exercise, I'm going to say it again because it matters. How much exercise and what type of exercise? How much do you sleep and the quality of your sleep? Those are a few of the crucial things that no one, and I mean literally no one in the health world that is a medical provider, will spend any time discussing with you if it is during a visit covered by insurance. There's no such time for these little details. We don't have time in 10 to 15 minutes to address all these issues. So find a wellness doctor, a doctor that can look into what's happening with your body, a doctor who can look at your family history, genetics, do some testing to understand your metabolic pathways. Are they clogged up? How much inflammation do you have? Let's look at your epigenetics. That's what surrounds your body. How is that impacting your health? Again, you're probably not going to get that with the wellness physical that's covered by your health insurance from a doctor that's going to spend 15 minutes chatting with you and examining you and ordering some simple blood tests without getting to know you from a comprehensive wellness standpoint. Again, I firmly believe comprehensive wellness checks should be done the right way with an in-depth analysis of all these markers. And I just mentioned diet, exercise, mental health, emotional, financial stress, your sleep, your family history, and a current review of systems, which I spent a lot of time talking about in the Wellness in Your 30s episode. Now, all of this, if we were to take an accurate intake of information, would probably take about 90 minutes. The most an insurance company will ever pay for a comprehensive wellness visit, it's literally under $200. So the reason why you're not going to find this type of care or comprehensive analysis with doctors that accept insurance is because it's impossible for them to provide this type of care without charging you something for it. Again, many doctors have struggled with this dilemma. Should I go cash and only provide care to people who can afford me? Or should I continue to take insurance and sacrifice my personal time and personal life by working longer and harder hours to document, to catch up with paperwork and do all the administrative duties so I can maximize face-to-face encounters with the patients and provide the excellent care I want to provide, but continue to take insurance? I can tell you that all the physicians who are providing cash pay only have been there, done that, have accepted insurance, and either they were smart enough to realize they were burning themselves out and they changed before the burnout, or the majority experienced the burnout and then changed to cash only. Now, I personally got confronted with the situation. Instead of going cash only, I decided to implement the membership fee. And this is pretty much the only way that the private practice doctors will continue to survive in a private practice, because the insurance reimbursements have gone so low that they just can't stay in business without charging you a membership fee or a concierge fee. Again, I've spoken about this in a previous episode on my social media. I don't want to make it about this, but the type of doctor that would offer functional medicine, wellness medicine, holistic medicine, hormone medicine, restorative medicine, and who is willing to accept insurance for it will become concierge if they're not already there. Now, again, I am a very big proponent of looking ahead and investing in maintaining your health rather than working on restoring health when you're sick. We, both you, the patient, and us, the physicians, and probably the healthcare systems to follow, we need to move away from the disease model, which is the predominant and only model rewarded and reimbursed by Medicare and the private insurance companies. Your insurance company should spend money to cover you for exhaustive visits and tests that would be spent in the name of wellness, not in the name of disease. Eventually, maybe some forward-thinking smart person out there will eventually establish an insurance plan that actually pays to keep you healthy. But the impossibility of achieving a profitable business venture out of this idea is because, let's be honest, both you and I and all of us are guilty of this. People are great procrastinators. People love to wait until the last minute, and unfortunately, everyone does that when it comes to their health. Now, I do have a very interesting population that I take care of, and some of them are really interested in wellness, but that's not typical. Most doctors see patients only when they're sick. If people don't feel sick, they don't go to the doctor. And women are very guilty of this because they are caregivers. They're just givers. They give to their career, they give to their family, they give to their spouse, they give to their children. They give themselves to housekeeping chores, shopping. They give themselves to everything before they give themselves anything. Does that make sense? Men hate going to the doctor for any reason whatsoever. I discussed this in a previous podcast. They just don't like being told there's something wrong. Maybe they suffer from the I'm a guy, I'm strong, there's nothing wrong with me syndrome. So men literally wait until something breaks. And if they think that nothing is broken, they're healthy, which is, again, a very wrong concept. Prediabetes, blood pressure elevations, belly fat, erectile dysfunction, fatigue, arthritis, and fatty liver are not okay. If you have any of these issues, you're not healthy, and therefore you will not be able to live the life in the body that I mentioned earlier in the previous episode when I described all that picture with the senior 80 that's not living the healthy lifestyle, right? You will not be able to enjoy everything that life has to offer because you will be limited by fatigue, pain, and weakness. Now, I do not want to get distracted because I keep going on these tangents. Let me stick to the topic of the wellness in your 40s. Now, I talked about the beginning of aging, which unfortunately starts in your 40s. I talked about your height, your weight, your blood pressure, your abdominal circumference, your body mass composition, and cardiovascular fitness. Let me dedicate a few minutes to talk about hormones. If you're a man in your 40s, please have your doctor check your testosterone level every year. I'm not the only person talking about the low testosterone epidemic. Mass media is talking about it. Many prominent figures in our healthcare agree that there is a low testosterone epidemic in men, regardless of age. What do you do if your testosterone is low? Well, you start looking at your wellness the way I mentioned before. You find a wellness doctor who wants to focus on your wellness and understand what is it in your lifestyle, in your environment that makes you have low testosterone. So you can rather be not faced with this situation in your 50s and beyond and all its consequences, and now the only solution is testosterone therapy for the rest of your life. But you can do something about it in your 40s to try to reverse course and address one of these key factors that's going to keep you young and well-functioning in your 50s and beyond, which is testosterone for men. Let's talk estrogen for women in their 40s. This is when women's estrogen is going to decline. This will trigger a decline or a loss of progesterone, creating estrogen dominance with very erratic estrogen levels. This is called perimenopause. Interestingly enough, I think I might have just created a definition for perimenopause, a medical one, but let's move on. I will dedicate the next couple of episodes, part 1 and part 2, on how to prepare for menopause. They're coming right after this episode, so please stay tuned if you're a woman and you're interested. If you're a man and you have a wife that's going through perimenopause, you might want to listen too. So testosterone for men is crucial. Everybody knows that. But so is estrogen for women. The loss of estrogen in women impacts many systems and organs, and women's health will start deteriorating, including their mood and mental health once estrogen starts declining. Now, checking your hormones in your 40s is not simple because they go up and down, and they could be different from cycle to cycle. Now, your cycle length is day 1 of your period until day 1 of your next period. And unfortunately, your cycle length is no longer reliable in your 40s. So planning a luteal phase hormone testing can be very difficult and impractical. You could test your hormones during a good cycle, or you could test your hormones during a bad cycle and you have no idea which one's which. Your body could have reliable good cycles more than 50% of the time in your early 40s to less than 30% of the time in your late 40s. Your doctor would ideally want to spend some time understanding your period pattern. As a woman doing a comprehensive wellness check in your 40s, your hormone wellness should be on the forefront of your concerns. And you should come prepared, and you should have all the information ready to be laid out to your physician. I cannot tell you how many times there is the or I don't know, or I don't keep track because my tubes are tied, or my husband had a vasectomy and I'm not really using birth control answer to tell me about your period. This is part of why doctors don't spend as much time as they should with their patients. Once the patient comes to the doctor clearly unprepared and does not know how to give answers to the doctor's questions, the doctor will really honestly might lose interest because he or she is human and will judge you as a person, will immediately label you as someone that's not interested in their health. Why would they be interested in spending time with you to educate you and talk to you about all these other things? Your weight, your height, your waist circumference, your body mass composition, when you do not even track your periods in your 40s, but you don't feel well. So again, they judge. So they believe that you're not interested or committed to your own health if you do not have the right answers. So please come to your wellness check prepared. I love it when my patients open up their app and they're like, "Doctor, Here it is. Here's all my cycles. I can track them. There's so many apps up there. Just download one and keep track of it. You can mark it on your calendar. You can open in your notes on your iPhone. Just open a note that says tracking cycles and just track your cycles. Just put down when your period starts, when the next period starts, and that's very valuable information for your doctor. Your period pattern analysis is critical. What you need to report to your doctor is how often your periods are coming reliably. They might not come reliably in your 40s. How long your periods are lasting, like 3 or 4 days, 5 days, 6 days, 7 days, and whether or not there are other symptoms that accompany your periods, like pain, nausea, vomiting, back pain, extreme and severe fatigue, and mood changes. None of these are normal. As a woman, your periods tell a story, and your story needs to be accurate and reliable in order for the doctor to be able to help you or understand what is happening with you. Remember, estrogen and progesterone testing might be unpredictable and impractical, especially in the second half of your 40s decade. But testosterone level testing is pretty reliable. If there are any variations, they are minimal. If you test testosterone, it's in your 20s, it might go up to 30s or so, depending on the time of the cycle, but it will not be 60 or more later in your cycle or during ovulation or in another cycle. It won't. There's not such a great variation. Ask for testosterone levels to be tested. Yes, your doctor might not know anything about testosterone, but believe me, the internet has a lot of information about testosterone for women and the value of testosterone in women. I have a lot of information for you in this podcast. And if you suffer from symptoms of testosterone deficiency that are making your life miserable, there is help. And one of the places where you can seek this kind of help is Hera Beauty and Wellness. So please knock on our door, give us a call, go to our website, herabeautyandwellness.com, open the window for communication with us and send us a message. We'll come to the rescue. Now, since I gave you a long speech about anti-aging and when you should be concerned with anti-aging modifications, lifestyle interventions, therapies, supplements, vitamins, you might want to consider testing so you can at least have a baseline for something called growth hormone. And this is both for men and women. Growth hormone levels can be tested with a simple blood test for a similar hormone called IGF-1 or insulin growth factor 1. If your IGF-1 levels are low, you can presume that your growth hormone levels are going to be low. And unfortunately, most adults over 50 will suffer from some form of deficiency because this is one of the hormones that automatically declines with aging no matter what we do. Does this mean that you need to start replacing growth hormone in your 40s or 50s? Far from it. You simply need to know what your baseline is, and your doctor, if he's a wellness doctor, would know and ask you and recommend it. Again, you should test again 5 years down the road and test again more frequently, maybe annually, as part of the wellness check in your 50s. Now, we are on the hormone chapter. If you fall into the category of overweight or obese, which unfortunately it's almost 50% of us now, you really need to check your fasting insulin, your fasting glucose, which is your fasting sugar, and your hemoglobin A1C. Insulin resistance is the beginning of diabetes, not a precursor for diabetes, it's a beginning. And prediabetes is completely reversible, but diabetes is not always, not so much. Again, another hormone we need to check during a wellness check, especially for women, is the thyroid hormones. Please do not believe that your thyroid has been checked until your free T3 and free T4 levels have been checked. Also, you should know that autoimmune thyroiditis called Hashimoto's will most likely affect women between the age of 30 and 50. That's where most of the Hashimoto is diagnosed. That is the 40s decade. Also, you should know that the female to male ratio for Hashimoto's is 10-1. If there are any suboptimal levels for your thyroid hormones, please notice I did not say out of range. I said suboptimal, which means under 50 percentile. That is the definition of suboptimal. Please ask the doctor to check your antibody titers. I don't check antibody titers routinely for all thyroid panels, but if I have T3 and T4 levels that are below 50 percentile, I definitely do. Many women are told their thyroid is normal when only a TSH has been checked. That is not a true wellness check for your thyroid by far. And just because your levels are in range, it does not mean they are optimal. So if you have symptoms, if you have positive antibody titers and suboptimal levels, you might need treatment. So to recap, the wellness check in your 40s would include height and weight, body mass composition, waist circumference, your blood pressure, some basic cardiovascular markers like resting heart rate, maximum exercise heart rate, and recovery heart rate, and some basic hormones, testosterone and growth hormone, insulin for men, estrogen, thyroid, growth hormone, and insulin for women, and obviously testosterone and progesterone for women as well. If you have additional health issues, then looking at cortisol might be necessary, but it is not a routine indicator for wellness, and it is more of a marker for adrenal dysfunction. Obviously, there will be some vitamin levels that can be checked with your annual blood work. I talked about that in my 20s checks. All of that still applies. But what I want to make a point about our 40s is that last but not least, one thing that needs to be checked and discussed and looked into. Many cancers manifest during our fourth decade of life. So a detailed review of your family history and a discussion about genetic testing might be in order. If you didn't know, let me tell you, 5 to 10% of all cancers are diagnosed between the age of 35 and 50. That's about what we're talking about right now, the decade of the 40s. According to an article in The Guardian that discusses cancer that I came across, more than 1 million people under 50 are dying every year of cancer. And this number is projected to rise by another 20% by 2030. This article also mentions that the number of people being diagnosed with cancer in their 40s worldwide has risen by nearly 80% in the last 3 decades. Let me repeat that. The number of people diagnosed with cancer in their 40s worldwide has risen by nearly 80% in the last 3 decades. Maybe these numbers highlight the importance of looking ahead and assessing cancer risk in your 40s and taking it seriously. We do believe that early onset cancer is due to an unhealthy diet, tobacco and alcohol consumption, lack of exercise, and increased rates of obesity. It ultimately all comes down to what we eat, how we exercise, and how we take care of our bodies. I will end here, and I hope you got some significant wisdom about what to look for in your 40s. And again, most of them are very simple and very basic, and you can focus on these as the essential wellness markers to look into, as giving you a good idea of what to start with before you enter your next decade, which is the 50s. Come back, if you're a woman, to listen to my 2 episodes about how to prepare for menopause. I'm excited about those. Hopefully, you will get some good information about that. And if you're a man that has an important woman in his life that is approaching menopause, you definitely want her to listen. Thank you so much for listening. If you are one of my faithful listeners and you are finding value and enjoying these episodes, please feel free to leave me a review on whatever platform you're listening to. Also, if you find the content in these topics useful, not just to you, but to someone else, a friend, a loved one, or simply an acquaintance that you know could benefit from the knowledge I share here, please feel free to forward my podcast to them. If you live in California and you'd like to work with our practice to help you achieve your wellness goals, please go to our website, www.herabeautyandwellness.com, and request an appointment. It will be our privilege to help you in any way, shape, and form we can. Any suggestions on a topic of beauty, wellness, or anti-aging are welcome. All you have to do is go to the website, leave a suggestion into the AI chat, and I promise you if you ask, I will listen and add your suggestion to my list of topics that I want to get to as soon as possible. Please join our Facebook group, The Wellness Optimizing Warrior MD. It's a small growing community that focuses on wellness, on what's new, what's safe, and what works in beauty, wellness, and anti-aging.